been proud to invest in the distribution of Thrival kits to at least 30,000 grade 4 to 6 students across our province. The kits incorporate evidence-based mental health practices such as mindfulness meditation, personal reflection, stress reduction, and coping strategies, as well as interpersonal skills development. The kits are introduced to children through activities led by their teachers throughout the school year. Today, we're investing an additional $21,000 to the Canadian Mental Health Association for the virtual component of Thrival kits. We're also reaching out to new funding to some organizations, including an additional $123,000 to the Mount Carmel Clinic for its Super Dads program and other services, and we'll hear more about that in a moment. Involving men is an important part of our partnership, especially when, in the past, services have excluded men from planning in their children's lives. The Super Dads program provides culturally centered teaching, support, healing, and health sessions to fathers. There is a need for services to support men in healing so that they can be more engaged in parenting and planning for their family's needs, helping to reduce the number of children that are in care. We have seen results, and we strongly believe in this program will continue to help us do just that. And we're investing $35,000 to the Clan Mothers Healing Village for its public education against sexual exploitation. It is an issue that unfortunately does not get talked about enough, but it demands all of our vigilance, protection, and support to prevent the exploitation of children. As a society, we must do all we can to protect our children and youth from those who would prey upon their innocence and their vulnerabilities. These investments reflect the need in Manitoba and were selected based on best practices that recognize the importance of cultural connection, safety, and prevention. I want to thank our partners for the work that they do, for reaching out to support Manitoba families. Your hard work is making a real difference in many Manitobans, and it is greatly appreciated. I'd also like to speak about the importance of healthy foods. Learning is enhanced by healthy foods that fuel children and set them up for success. Today, we're investing more than $2 million to extend the Home Nutrition and Learning Program until the end of August, so participating children can continue to be protected through the provision of nutritious breakfast packages. This funding will ensure that thousands of children continue to receive nutritious breakfasts to start their days off right and to support their learning goals. These supports for families with school-age children who are experiencing food disruption as a result of the COVID-19 pandemic will ensure that families continue to receive their weekly boxes containing nutritious breakfasts, foods, and simple child-friendly recipes and learning activities. Manitobans are encouraged to visit mbnutritionlearning.ca to learn more about the pilot program and to explore the available resources and learning activities. I'd now like to ask my colleague, Audrey Gordon, the Minister of Mental Health, Wellness and Recovery, to the podium for her remarks.
Good morning, everyone, and thank you, Minister Squires. For some time, the Manitoba government has taken a whole-of-government approach to addressing mental health and addictions. This is because our government understands that mental health is just as important as physical health, and we know that many people are struggling with the additional pressures created by the COVID-19 pandemic. That's why we implemented Ability CBT, a free digital therapy program available to all Manitobans age 16 and over who are struggling with the effects of the pandemic. We've also invested in more than 20 programs to support people living with addiction at risk of violence and struggling with trauma. We've also opened several rapid access to addictions medicine, or what we call our RAM clinics, right across the province. But we know there's much more we need to do to support people during this difficult time. We're committed to protecting Manitobans, and this investment will help ensure that high-quality mental health and addiction services are available to those who need help. Today, we're announcing funding of $200,000 to the Manitoba Adolescent Treatment Centre. for clinical assessment and referral services in Thompson. This funding will enable MATC to provide in-person clinical assessment and referral services for youth in the City of Thompson and the surrounding areas with mental health concerns. The work will support youth engaged with Street Reach Thompson, which is showing strong results in connecting with high-risk youth. It will also provide stronger coordination referral supports between existing mental health and addiction resources for youth in the region. We know that COVID-19 has resulted in changes to street drug accessibility, increase in the risk of opioid overdose. That's why we're providing $60,000 for community living disability services clients for naloxone kits. Funded agencies specializing in supports for high-risk adults with intellectual disabilities will be able to access up to 275 naloxone kits to help save lives. These investments align with recommendations in the Virgo report, and we remain committed to supporting community agencies as they do this important work. I want to echo Minister Squires and thank our partners for the work that they do. Those reaching out to care for and support vulnerable Manitobans are some of the most generous, most kind, and most caring people. Your dedication and commitment is valued and appreciated. I also want to note the work underway to support Manitoba families who are facing food insecurity because of COVID-19. And the investment mentioned by Minister Squires extends the Home Nutrition and Learning Program to keep the food deliveries going to participating families when school is not in session this summer. Children, of course, need nutrition daily, even when they are not in classes. The investments announced today will allow the provision of food to continue. Thank you all once again for joining us today, and I'll now turn it back to Minister Squires.
Thank you so much, Minister Gordon, for your commitment and your implementation of those recommendations to help Manitoba families. So now I'd like to call upon one of our local heroes who has made an impact and a difference in the lives of so many Manitobans, particularly our vulnerable young people in the province, Babette Schaffner, who is the Executive Director of Mount Carmel Clinic, to make some remarks this morning. Thank you, Babette.
So thank you to Minister Squires and Minister Gordon for having me here today. I'm very excited to share in this announcement of funding. For us at Mount Carmel Clinic, this means $48,000 towards our Super Dads Warrior Caregivers program and $75,000 for our Chiropractic Program. Last year, we were very fortunate to receive funding to expand our mothering project, or our Manitu Ikwe Kagiikwe program. That contribution effectively doubled the capacity of our program, and we're now able to serve an additional 100 women and families in the North End, supporting healthier families and brighter futures for our children. We're thrilled that this year we'll be able to restart our Super Dads program. Mount Carmel Clinic maintains many programs and opportunities for women in our community, as do many others, but we were not providing enough opportunities for men to engage in healing. So Super Dads Warrior Caregiver program addresses this gap. The program was established as a result of feedback from our dads and men who told us there was an absence of programming specific to their needs as men and fathers. That is how our Super Dads Warrior Caregivers program was established. It's a program that is culturally grounded and developed in partnership with the men in our community, our knowledge keepers, and Mount Carmel Clinic staff. The program focuses on attachment, parenting, and child development, as well as Indigenous culture, traditions, and parenting styles. These sessions develop organically in some areas based on dads' interests and traditions. This flexibility makes the program more successful and accessible to fathers in our community. In addition, our families can take part in sharing circles and ceremonies that are part of our land-based teachings offered at Mount Carmel Clinic. We're really thrilled to have this program back up and running again. We've been leaving our men out for a long time, and it's time to bring them into the fold. Our chiropractic program is also critically important for the people we serve in our community. In 2011, the province of Manitoba initiated a chiropractic pilot program with us at Mount Carmel Clinic, and we've been super proud to be able to host that program ever since. Mount Carmel Clinic offers interdisciplinary healthcare services often to the most vulnerable and marginalized clients. The chiropractic program allows us to expand access to alternative methods of care that our community members would otherwise not have access to. It also provides much-needed intervention for patients suffering from chronic and acute musculoskeletal conditions. By providing this access to care option, our chiropractic service can not only reduce the pain and discomfort experienced by our patients and our clients, but also reduce their reliance on medications, specifically opioids, for managing their pain. Having chiropractic care available at Mount Carmel Clinic not only benefits our clients already served at Mount Carmel, but also creates a much-needed referral option for our partner organizations in the community. Funding such as this from the province of Manitoba should be seen as an investment in the health of our community members and the future of our children and families in the North End. Positive effects from proactive programming rather than reactive programming are invaluable, and the impact on our community will have long-lasting effects. I would like to thank Minister Squires and Minister Gordon and all of their staff behind the scenes. There's a lot of folks that help us out to make this happen. I'd like to thank them for their continued support for our community and Mount Carmel Clinic and the work that we do. I also want to thank our dedicated Mount Carmel Clinic staff who provide an extraordinary level of care and compassion every day at Mount Carmel Clinic. They're really what makes this happen. Thank you to the Manitoba Chiropractic Association and especially Dr. Gerald Olin and Dr. Audrey Toth, as well as Mitch Bourbonnier at the Action Therapy for their support. I'd like to thank the Winnipeg Boldness Project for their support, and specifically our leaders and group at Gwakanamud. And most importantly, I'd like to thank our community members who continue to show up and trust us on a daily basis. They continue to amaze me with their resilience, their steadfast commitment to their health and well-being, and the thriving of their families. Thank you.
Thank you so much, Babette, for all the work that you do on behalf of Manitoba families. Now I want to invite another local hero who is really making an innovative difference in the lives of many families with some programming and services that are very, very innovative and helping divert families coming into CFS care. So I'd like to invite Josie Hill from Blue Thunderbird Care and Granny's House to come up to the podium to make a few remarks.
Well, good morning. Thank you, Minister Squires. Thank you, Minister Gordon. Blue Thunderbird and our Gwakanamud partners, Boldness, Andrew Street Family Centre, Wabung, Abinogiac, Mount Carmel Clinic, couldn't be happier to continue our work at Granny's and to develop a second one. Throughout what has been an especially stressful year for families and children, Granny's House has become part of the extended family for parents and children, providing a source of comfort and support. The parents take comfort in knowing their little ones are truly loved and cared for. The little ones love coming to Granny's for all the special attention they get from their new granny and aunties. Granny's House has been able to build on the trusting relationships our Gwakanamud partners have built with families. Granny's has added to that support, comfort, and care for parents and little ones. Parents arrange respite for themselves to go shopping, really clean the house, spend special one-on-one time with one of their children while the others are at Granny's, attend appointments, or just have some adult time to care for themselves. It may sound simple and straightforward, but for parents to have the comfort in knowing their children are cared for and can exercise their right as a parent to determine what they need and when they need a break, it's huge. Thank you, Minister Squires, for your support. Thank you, Minister Gordon. And thank you, parents, for sharing your little ones with us.
That is absolutely beautiful. Thank you so much, Josie, for everything that you do. And earlier in our conversation, you said, you know, it's so simple that it works, and really very, very grateful that you've developed this program and this service and that it's working in our communities, and really proud to be part of a government that is investing in its expansion. So all the best to you in future years. So that concludes the formal remarks for this program, and we are more than happy to take your questions should you have any. Okay, let me just put my mask on and we'll trade places.
Thank you for the question. So firstly, I want to say that our government has moved very strongly to address the issues of mental health and addictions here in our province by creating this ministry. We are the second province in Canada to have such a ministry, and we are going to continue to work with our service delivery organizations, of which there are over 40, to identify what the needs are and what issues and concerns have been amplified as a result of the pandemic. We're also assisting our first responders, like police, with risk assessment, IT programs where they can assess an individual right in their vehicle and determine what types of services, referrals, or supports that they need. So certainly want to look at what other supports may be needed, but always willing and open to sitting down and talking with our stakeholders about what they're seeing in their communities and how government can partner with them to help.
Are there any initiatives aside from the risk assessment
Well, I'll talk more about what I recently announced for young people, which is our youth hubs. So we are establishing 5 additional youth hubs across the province, and we feel that this will be a one-stop shop where an individual can go right in their community without law enforcement involvement and seek help with addictions, mental health, being connected to primary care and other resources. So we hope to have those 5 additional youth hubs. The first one we rolled out was in 2017 at Northwest Co-op, and that has shown such amazing and great results for young people that we're rolling out 5 additional. So we will have 6 across the province, and these, as I said before, will be right in the local community and will give individuals an opportunity to just walk in. And some of our youth have said, we want a place to just hang out where there's no judgment and no criticism, and that is what we will be establishing right in the community. So we're looking for those youth hubs to really make a market change in what we're seeing on the streets. Well, certainly through the IM Health, a program that I mentioned, that risk assessment program available right in the cars for the police to use. We are always open to sitting down with our law enforcement officers and hearing what the needs are and how we can partner with them to provide enhanced services or to assist them in their day-to-day work. Well, one of the things I've said even in the House is that our engagement and discussion with our stakeholders is not a start and stop program. We are always talking with our stakeholders at all different levels, federal, provincial, city, and we're going to continue our discussions to identify the needs and to help with supports that can can help individuals in our local communities.
Oh, we don't know yet. We're looking. What is Granny's house is, it's a nice big 3-bedroom house. We have children, we get referrals from our partner organizations, and so we build on that relationship they would have had with the families, and now we have that relationship. So for parents to be able to go shopping safely without having to take 5 children with them, get on a bus, those kinds of things, it's very simple. Mom's having a bad day, she can call Granny's and we can figure out how to bring the children over. So we operate 24 hours a day, 7 days a week, and we have children stay over, and we have Granny there, and we always have an auntie or two. The new money will go towards funding Granny's for a second year and to open a second house. And we'll open it in the north end. We just haven't found a location. There's always kids in the house, 24 hours a day. You know what, I didn't bring the numbers with me. I apologize. I can't say. I can say that when we first opened, we used to have sometimes 2 families of kids in the house. But since COVID, we're having 1 family at a time, so we can disinfect in between and bring another family on to make sure it's safe for all the children and families. Absolutely. I think oftentimes families don't get to ask for help until they're really, really in a bad situation. I think if they can call Granny's house and say, you know what, I really need a break, I really need to go to this appointment, I really need to spend one-on-one time with one of my children, for them to be able to have that help without any judgment, without any penalty that they're actually struggling, but to actually be able to reach out and to somebody they trust will take good care of their kids and come and help them out.